We're going to discuss some eye injuries now. Discuss eye injuries. Most of them are very freaky. You can tell stories of patients that have had eye injuries and you say, oh, come on, how did that happen? It's a very strange story a lot of times because it's really a lot of circumstances have to come together to cause an eye injury. The eye is somewhat protected by your eyelid for one thing and by the orbit by your face. So it's very protected. So a lot of eye injuries are really strange and freaky injuries. Corneal abrasion. You could be wrestling or doing something and you get kind of poked in the eye and you get a corneal abrasion. Again, remember, pain and photophobia. If that's being reported or you're reading the test question and they talk about pain and photophobia, then always think of something like corneal problems. Don't think of just a normal conjunctivitis. The diagnosis, they like to ask how you'd make the diagnosis. And for this particular entity, you're going to do what's called the fluorescein test. You got to know that. That sounds like a test question right there. You take some fluorescein and you just a little fluorescein strip, put it on the eye, and then you use a cobalt blue light. And you shine it in the eye, and the area of abrasion will light up. And I'll show you a picture in a second. The treatment will be just giving them something for pain and patch up the eye. You re-examine them 24 hours later. If they're not any better, you refer them to the ophthalmologist. Here is the top picture. They are actually putting the strip on, the fluorescein strip. And then when you look under the light, you see this area right here that's all this color is the actual corneal abrasion. That whole area is the corneal abrasion. They tend to heal up on their own. Just with the patching, but that's what it looks like. A classic question would be, what would be the test? Do the fluorescein test. Many times you can get a history with a foreign body in the eye of the patient saying something, I felt something shoot up into my eye. And many times you can just see it grossly in the eye with your ophthalmoscope. Sometimes you can just see it with your own eye. A foreign body on the eye will cause irritation. For example, somebody might have a little bug or gnat on the eye, and those can be just flushed out. But you do not want to remove anything that is in the eyeball. You want to send them to the ophthalmologist. If you remove a metal shard or something like that in the eyeball, you can actually have oozing of the vitreous. So that's an automatic referral.